Dr. Sam Boland is the acting incident manager at the WHO Regional Office for Africa. He discusses the dangers the new Mpox variant posed globally and what is being done to contain the epidemic.
The response to Mpox in the African region has already very much been ongoing. So both in countries that are actively affected as well as in countries that are at risk, the World Health Organization has been working with ministries of health and member states, as well as coordinating partners to be sure that we're already actively responding to this particular problem. The declaration of a public health emergency of international concern that was made by Director General Tedros earlier this evening really serves as a call to action to the global community, which can have a lot of positive consequences for our ability to effectively respond to the crisis at hand. So in addition to all of the work that was already ongoing, what this means is that we can work with the international community to make sure that we have the resources available to respond. And the World Health Organization has been supporting countries in the African region, for example, South Africa, to be sure that they're able to access doses of this very novel therapeutic to be sure that people are able to get the clinical care that they need. And this is a very difficult process, and it's the same process that is true for vaccination, which is that really one of the barriers is a regulatory one. We have to work country by country to be sure that countries are able to import and then put to use something like the therapeutic that's available, or in the future, the vaccinations that we may be able to roll out. Sometimes, depending on the country or specific outbreak we're talking about, it is possible to identify a patient from whom we think the first case was communicated from what we call the animal reservoir. In the case of the outbreak in the Democratic Republic of the Congo at this moment in time, however, really we're talking about cases that are being communicated between one person and another person. As the WHO ourselves and under the international health regulations and our emergency response framework, we work very, very hard to be sure that we're in a position to support coordination between all partners, including the Africa CDC, but also including other UN agencies such as UNICEF and other INGOs and the like, to be able to ensure there's a harmonized, synergistic, and coherent response to this particular crisis at hand.